I want you to listen very carefully to what I am about to tell you. Because this morning, before you eat anything, before you drink your coffee, before you do anything else, there is one thing I want you to know about: a single fruit. One fruit that researchers have been studying for over a decade. A fruit that most people walk past in the grocery store without a second thought. And yet, the science behind what this fruit does to your blood sugar levels, especially if you are over the age of 60, is nothing short of remarkable. My name is Dr. Thomas Reed. I'm a physician in internal medicine, and I have been helping seniors manage blood sugar, diabetes, and metabolic disease for over 25 years. And in all my years of practice, I have never seen a single dietary intervention generate as much consistent, measurable improvement in my patients' blood sugar readings as the one I'm going to share with you today. Now, let me be honest with you up front. I am not going to sell you anything. I am not going to ask you to buy a supplement or sign up for a program. This fruit costs less than $2. You can find it at any grocery store. And if you eat it the right way, at the right time, what it does to your blood sugar while you sleep is something your doctor has probably never mentioned to you. So stay with me, because by the end of this video, you are going to know exactly what this fruit is, why it works, how to eat it correctly, and what the science actually says, not opinions, not trends, real published research. Let's get into it. First, I need to give you some context about what is actually happening inside the body of a senior who has blood sugar problems. Because understanding the problem is the first step to understanding why this solution works so well. When you are young, in your 20s and 30s, your body handles sugar very efficiently. You eat a meal, your blood glucose rises, your pancreas releases insulin, insulin unlocks your cells and lets the glucose in for energy, and your blood sugar comes back down. Clean, efficient, fast. But starting around age 50 and accelerating significantly after 60, something changes. Your cells begin to resist insulin. They stop responding to it the way they used to. Your pancreas has to pump out more and more insulin just to get the same result. And even then, glucose lingers in your blood longer than it should. This is called insulin resistance. And it is not just a diabetes problem. Even people who are not diabetic, people with what doctors call prediabetes or even normal blood sugar, are often walking around with low-grade insulin resistance that is quietly doing damage to their blood vessels, their kidneys, their nerves, and their brain. Here's what makes it worse. When you sleep, your body goes through something called the dawn phenomenon. In the early morning hours, between 3 a.m. and 8 a.m., your body naturally releases stress hormones like cortisol and growth hormone to prepare you for waking up. These hormones tell your liver to release stored glucose into your blood. In a healthy person, insulin handles this quickly. But in someone with insulin resistance, which includes the majority of adults over 60, this morning glucose dump goes unchecked. That is why so many seniors wake up with high fasting blood sugar, even when they did not eat anything since dinner the night before. Their liver is pumping glucose into their blood while they sleep, and their insulin cannot keep up. This is the problem, and this is exactly what the fruit I'm going to tell you about addresses. The fruit is berberine activating, fiber-rich, polyphenol-loaded, and it grows in warm climates all over the world. It is affordable, accessible, and eaten by billions of people, but almost never for this reason. The fruit is the bitter melon. Now, before you click away, stay with me, because I know bitter melon sounds unusual. It may not be something you grew up eating, but I want to walk you through exactly what the science says, because the evidence behind this fruit is stronger than almost anything I have seen in natural blood sugar management. Bitter melon, known scientifically as Momordica charantia, has been used in traditional medicine in Asia, Africa, and the Caribbean for centuries to treat high blood sugar. But what makes it remarkable is not tradition. What makes it remarkable is what modern science has found when they actually studied it. Bitter melon contains at least 3 active compounds that directly affect blood sugar. Let me explain each one. The first compound is called charantin. Charantin is a phytochemical, a plant chemical that has been shown in multiple studies to have a blood glucose lowering effect comparable to some pharmaceutical drugs. It works by stimulating glucose uptake in the muscles and liver, essentially doing the job that insulin is supposed to do, but doing it through a completely different pathway. This is critical for seniors with insulin resistance because even if your cells are no longer responding well to insulin, charantin can still push glucose out of the blood and into the cells through its own mechanism. The second compound is polypeptide P. This is sometimes called plant insulin, and for good reason. Polypeptide P mimics the action of human insulin at the cellular level. When it enters your bloodstream, it signals your cells to absorb glucose. Studies conducted in India and China have shown that polypeptide P can produce a measurable drop in fasting blood sugar within hours of consumption. The third compound is visine. Visine works differently. It targets your liver, specifically the liver's tendency to dump excess glucose into the bloodstream during the night. Remember the dawn phenomenon I told you about earlier? Visine helps suppress that process. It reduces hepatic glucose production, meaning it tells your liver to calm down and stop flooding your blood with sugar while you sleep. This is why eating bitter melon in the morning before breakfast is so powerful. You are loading your body with all 3 of these compounds right at the time when your blood sugar is at its most vulnerable. You are giving your cells a natural plant-based signal to absorb glucose more effectively throughout the entire day. Now let me tell you what the research actually says. A study published in the Journal of Ethnopharmacology followed diabetic patients who consumed bitter melon daily for 4 weeks. At the end of the study, fasting blood sugar levels dropped by an average of 12%. In some patients, the drop was even more significant. Another study published in the Journal of Nutritional Science and Biotechnology found that bitter melon extract significantly reduced blood glucose levels after meals, what doctors call postprandial blood sugar, which is one of the most important markers for long-term diabetes control. A third study, conducted specifically in older adults, found that regular bitter melon consumption improved insulin sensitivity, meaning the cells started responding better to insulin again over a period of 8 weeks. And perhaps most relevant to what I said earlier about the liver, a 2019 study found that bitter melon extract reduced liver glucose output in animal models by up to 30%. That is a dramatic effect on the very mechanism that causes high fasting blood sugar in seniors. Now, I want to be clear about something. Bitter melon is not a cure. It is not a replacement for your diabetes medication. If you are on metformin or insulin or any other blood sugar medication, please do not stop taking it because of this video. What bitter melon is a powerful natural addition to your daily routine that works alongside whatever you are already doing to support healthy blood sugar levels. In my practice, I have had patients who added bitter melon to their morning routine and saw their fasting blood sugar drop by 10, 15, even 20 points within a few weeks without changing anything else. These are not dramatic pharmaceutical results, but for a piece of fruit that costs less than a cup of coffee, those results are extraordinary. So now let me tell you exactly how to use it. There are several ways to consume bitter melon, and the method matters. Let me go through them in order of effectiveness. The most effective method is fresh bitter melon juice. This is the form used in most of the clinical studies that showed the strongest results. Here's how to make it. Take 1 small to medium-sized bitter melon. You can find them at Asian grocery stores, Indian grocery stores, Caribbean markets, and increasingly at mainstream supermarkets. Wash it thoroughly. Cut it in half lengthwise and scoop out the seeds and the white pith in the center with a spoon. The seeds and white pith are where most of the bitterness is concentrated. Removing them makes the juice much more tolerable. Chop the green flesh into pieces. Add it to a blender with a small amount of water, about half a cup, and blend until smooth. Strain it through a fine mesh strainer or cheesecloth and drink the juice immediately. The recommended amount is approximately 50 to 100 milliliters, that is roughly 2 to 4 ounces, of fresh bitter melon juice per day. Drink it first thing in the morning on an empty stomach, at least 20 to 30 minutes before breakfast. This timing is important. Drinking it on an empty stomach maximizes the absorption of the active compounds and allows them to begin working before your first meal raises your blood sugar. The taste is bitter. I will not pretend otherwise. But many of my patients have found that adding a small squeeze of lemon juice or a slice of fresh ginger makes it much more palatable. You can also mix it with a small amount of cucumber juice or green apple juice, both of which are low in sugar, to balance the flavor without reducing the effectiveness. If fresh bitter melon is not available in your area, or if the preparation feels like too much effort, there are 2 alternative forms worth knowing about. The first is bitter melon tea. Dried bitter melon slices are widely available online and in health food stores. Steep 3 to 4 slices in hot water for 10 minutes and drink it as a morning tea before breakfast. The concentration of active compounds is lower than fresh juice, but the effect is still meaningful. The second is bitter melon capsules or extract. This is the most convenient option and the form used in many of the clinical studies. Look for standardized bitter melon extract. Charantin content should be listed on the label, and follow the dosage instructions on the product you choose. Typical doses in studies range from 500 to 2,000 milligrams per day. As always, check with your doctor before starting any supplement, especially if you are on diabetes medication, because bitter melon can enhance the effect of those medications, and you may need to monitor your blood sugar more closely. Now I want to talk about something that I think is equally important, and that is what to pair with bitter melon to maximize its effect. Because bitter melon works best as part of a morning routine, not as a standalone trick. Here is the morning blood sugar protocol I give to my senior patients who are working to get their glucose under control naturally. Start with a full glass of water, 12 to 16 ounces, the moment you wake up, before anything else. Your body has been fasting for 7 to 9 hours. Hydration helps your kidneys flush out the glucose that accumulated in your blood overnight. Then, 10 minutes later, drink your bitter melon juice or tea. Wait 20 to 30 minutes before eating breakfast. For breakfast, choose a meal that is high in fiber and protein and low in refined carbohydrates. Eggs with vegetables, Greek yogurt with berries, avocado on whole grain bread. These foods create a slow, steady glucose release instead of a spike. Add cinnamon to your breakfast. Literally sprinkle it on your food or stir it into your yogurt. Ceylon cinnamon, not cassia cinnamon, has been shown in multiple studies to improve insulin sensitivity and reduce fasting blood sugar. Half a teaspoon per day is enough to produce a measurable effect. After breakfast, take a short walk, even 10 minutes. Walking after a meal is one of the most effective things a senior can do for blood sugar control. When you walk, your muscles absorb glucose from the blood directly without needing insulin. Studies have shown that a 10-minute walk after meals reduces postprandial blood sugar spikes by up to 22%. This morning routine: water, bitter melon, low glycemic breakfast, cinnamon, short walk, is the foundation I have built for dozens of my patients, and the results consistently have been remarkable. Now let me tell you who should be especially careful with bitter melon. If you are pregnant or breastfeeding, avoid bitter melon entirely. It has been associated with uterine contractions in some studies. If you are on insulin or sulfonylurea medications, drugs like glipizide or glyburide, please monitor your blood sugar carefully when you start taking bitter melon, because the combination can cause blood sugar to drop too low. This is not common, but it is possible, and your doctor should know you are adding it to your routine. If you have G6PD deficiency, a genetic enzyme disorder, avoid bitter melon as it can trigger a type of anemia in people with this condition. For the vast majority of seniors who simply have elevated blood sugar, prediabetes, or type 2 diabetes managed with lifestyle or metformin, bitter melon is safe, well tolerated, and genuinely effective. I also want to share with you 3 other foods that work synergistically with bitter melon, meaning they amplify each other's effects when eaten together or in the same day. The first is fenugreek seeds. These small golden seeds contain a compound called galactomannan, a soluble fiber that slows the absorption of sugar in the intestine. Soak 1 teaspoon of fenugreek seeds in water overnight and drink the water first thing in the morning before your bitter melon juice. The combination of fenugreek water and bitter melon juice is one of the most powerful natural blood sugar protocols in traditional Ayurvedic medicine, and now supported by modern research. The second is berberine-containing foods, specifically barberries and golden seal. Berberine is a plant compound that activates an enzyme called AMPK, which is sometimes called the metabolic master switch. Activating AMPK improves insulin sensitivity, reduces liver glucose production, and helps cells absorb glucose more efficiently. Berberine has actually been compared to metformin in clinical studies with comparable results in some populations. The third is apple cider vinegar. 1 tablespoon of raw apple cider vinegar and a glass of water drunk before a high carbohydrate meal has been shown to reduce the blood sugar spike from that meal by up to 31%. The acetic acid in apple cider vinegar slows gastric emptying, meaning food moves more slowly from your stomach into your intestine, which flattens the glucose curve. These are not magic cures, but they are real, scientifically studied, accessible tools that seniors can use every single day to take control of their blood sugar without waiting for a prescription. Let me now bring everything together for you. If you are over 60 and you are dealing with high blood sugar, prediabetes, or type 2 diabetes, your body is fighting a battle every single morning before you even open your eyes. Your liver is releasing glucose into your blood. Your cells are resisting insulin. And every high blood sugar event, every spike, every overnight elevation is doing quiet, cumulative damage to your kidneys, your eyes, your nerves, and your heart. But you are not powerless. 1 fruit, 1 morning routine, consistent and simple. Bitter melon, eaten or juiced every single morning on an empty stomach, delivers 3 powerful compounds: charantin, polypeptide P, and visine, directly into your bloodstream right when your body needs them most. It improves insulin sensitivity. It reduces liver glucose output. It helps your cells absorb sugar more effectively. And it does all of this naturally, affordably, and safely for the vast majority of seniors. So here is what I want you to do starting tomorrow morning. Find bitter melon. It may be at your regular supermarket. It is almost certainly at an Asian, Indian, or Caribbean grocery store near you. Or order it online, fresh, dried, or in capsule form. Try it for 30 days. Check your fasting blood sugar before you start. Check it again after 30 days. Let the numbers tell you the story. Pair it with the morning routine I described: water first, bitter melon, low glycemic breakfast, cinnamon, a short walk after eating. And please tell your doctor what you are doing, Bring this information to your appointment. Ask them to monitor your blood sugar more closely during this period. A good doctor will support you in this. You have more power over your blood sugar than you have been told. I am Dr. Thomas Reed. I hope this video has given you something real and useful today. If it did, please share it with someone you love who is struggling with their blood sugar. They need this information. Leave your questions in the comments. I read every single one. Take care of yourself, and I will see you in the next video.